Welcome to the Sisterhood of Sweat. I am here today with Dr. Carolyn DeLucia. Dr. Carolyn DeLucia, MD, FACOG, is a pioneer at the leading edge of non-invasive sexual wellness treatments, a practicing OB/GYN for nearly 30 years, and alternative therapy expert since 2014. She is sought after by device manufacturers and professional groups alike. Today, Dr. DeLucia is one of the most in-demand specialists in the field. She has trained thousands of practitioners around the world and impacted the lives of countless patients. As the technologies and case studies evolved, so did Dr. DeLucia's private practice, assembling her expertise as a physician and knowledge as an expert in the applications of cutting-edge treatments. Dr. DeLucia has developed her own combination therapies and techniques. Some of her specialties include non-invasive body sculpting, no-touch pelvic floor toning, platelet-rich plasma injection, and bioidentical hormone therapy, with the FDA overreaching into women's sexual health care by potentially doing away, oh my goodness, no, with compounding hormones. Dr. DeLucia is passionate about advocating for her patients' rights to personalized treatment. Oh, it was so amazing today, you guys. She went over so many things that are taboo that women don't talk about, they're afraid to ask, they're wondering about, and they have no idea how to solve the problem. We went into vaginal dryness, painful sex, no libido. She said, you don't even think Brad Pitt and George Clooney are with it or handsome anymore, because you have such a lack of interest in that department. And she also talked about incontinence and how what the cure for that could be, solutions. She talked about all kinds of non-invasive cosmetic procedures. I mean, you'd pay big bucks to ask the doctor the questions I asked her today and probably not get more than 10 minutes of their time. So this was so good today. And I think it's going to help a lot of women out there with solutions and some ideas in what direction to go to help a girl out. So I hope you guys enjoy this episode today. I know I enjoyed being the interviewer. So without further ado, we're going to dive in with Dr. DeLucia. I'm very excited to welcome Carolyn DeLucia to the Sisterhood of Sweat today.
Thank you so much for having me. It's so exciting to be here.
Well, you are after my own heart already because you're from New Jersey, and I always get along with Jersey girls, just about like it's typical for me for some reason. And I think, like I said before, it's because you guys are straight shooters, and I like that. Now, my boss, he was a little blunt, but that I have to say I appreciated that, because I always knew where I stood with him back in the day. Now I own my own business, and it's all about female empowerment and letting women know what their value and their worth is. And when they know these things and they can become advocates for their health and know, like you said,
yes,
you don't like women to suffer. So we're going to go from that. I want you to just give everybody what your backstory is, and we'll start diving into our topic about women's health today.
That is so much fun. Thank you. And we couldn't be more on the same page. It's all about giving women a voice. And my mission that I've been on for the past 7 years, really dedicatedly, is trying to get the word out that intimate health is extremely important. It's the glue to our relationships, and we don't have to let it go by the wayside. Women suffer. They think because intimacy, they may lose interest. They may lose sensation. They may be in pain. None of those are reasons to turn your back literally on your partner and not be intimate.
Mm.
And it's a heartbreak. As I'm a board certified gynecologist, I've been in private practice since 1992. And from where I take my unofficial surveys, my little stool down there when I'm looking up at you, when I'm down there and taking my asking questions, and I hear women say, when I say, how are things in the bedroom, or how is sex going? And they say, oh, I don't do that anymore.
Oh my gosh, you know what? I'm in the same space as you,
Yeah.
because I mostly deal with women of a certain age, and
Mhm.
I am hearing that so much. So
Mhm.
give us some help today on that.
Oh, there is so much hope, so much hope. And that's my mission, is to let women know that there is an entire realm, a whole specialty evolving worldwide that is specifically geared towards maintaining our intimate health. And there are non-invasive, painless, non-hormonal, as well as hormonal ways of keeping us in it, wanting it, deserving it, enjoying it, owning it, and moving forward with our intimacy.
Oh
That's the
my gosh.
key. That's the key.
I almost want you to repeat that again. Oh my gosh, enjoying it.
Yeah.
How about
Yes.
our gals that their vag is getting dry,
Yes.
and like you feel like it's sandpaper when you're having, conjugal rights with your mate?
That's
What
exactly
can
right.
we do for women, non-hormonally and hormonally, to help them
Uh-huh.
not feel like, oh my gosh, this is painful?
Yes. The way I describe it, and whenever I lecture, I specifically tend to say this to the men because they don't get it. And any woman with a partner, she knows he takes it personally. He says, you don't love me anymore. I don't do it for you anymore. All these kinds of statements that just put so much of a divide between the couple, not necessary. And I describe it as having sex with your round hairbrush we blow our hair dry with. Honey, why are you using the chi? Put my chi down. Where's that other thing we used to use? It no longer feels like anatomy. It's like, what is going on? When that first happened to me, I'm 59. When that first
Oh my
happened,
gosh,
I,
I'm gonna be 59 soon.
oh, happy birthday. So
Thanks.
I was like, what in the world is going on? And then I lost all sensation. Okay. Rub your forehead. That's what it felt like. Nothing, nothing. So why bother? It's not fun and it hurts. What were we doing there then? Right. So, bottom line is there are non invasive ways, very simple, 5 minutes in the office, lasers. There are two types of lasers, generally speaking, classifications. There's CO2 lasers and erbium lasers that are on the market. Laser sounds scary, but it's not scary. It's not.
I'm thinking laser my badge. I don't know.
Yeah. Very, very superficial. So most of us know that in the cosmetic world, that there are lasers that have been used to resurface the skin of the face. And those lasers, called Pixel or Fraxel, are very gentle. There's maybe a 3-day downtime after you do it where there's like little marks on your face. It doesn't really hurt and it heals and the skin is rejuvenated. They have modified that exact same laser, created a probe that goes right into the vagina and it's painless and it takes 5 minutes to cover the entire vaginal wall, bringing new blood supply, collagen, and sensation to the vaginal walls. Not only that, it helps to support the front wall of the vagina, which is our bladder, and can help with the leaks. When you,
Oh, how amazing is that?
yep, when you go out with your girlfriends and everyone says, don't make me laugh, I'm gonna have to cross my legs, I'm gonna pee my pants. No, with this, no more peeing your pants. You can go jump on the trampoline with the kids. You're not gonna pee your pants.
And you don't have to put mesh in there.
And no mesh. That's
amazing.
gonna erode, and you can see that is a mess. What a mess the meshes are, and the slings. So this is exactly right. And the laser painless. There's radio frequency. Radio frequency is devices. Now, the first loop of those devices that came to the market, very wonderful, just a little long, 20-30 minutes of a probe in and out of the vagina. I can't get a lover to spend that much time in there. I don't want some weird probe. So, basically but they've modified it now, and they're as quick as 8 minutes in and out of the vagina in 8 minutes. And that as well brings a beautiful sense of lubrication and ability to accommodate and cling. So I'm going to take a step back, if that's okay. Before we have children, the vagina is like a cylinder. It's round and long. After a child, even carrying it and having a cesarean section, it's kind of a square. It falls in from all 4 sides. The top wall is the bladder, the bottom is the rectum, and the sides are basically our support walls. And when they're floppy, you lose that sensation and tone and ability to cling to what's penetrating. Therefore, there's loss of sensation. So the radio frequency and the laser bring back an overstretched rubber band to a brand new rubber band and help with sensation and support of all those walls. Then go ahead.
So after a woman has this done, how, sore will she be? How quickly will she recover, and how soon will she be able to get the results sexually?
Beautiful, beautiful. Number one, the laser has a 3-day downtime, so no penetrating intercourse for 3 days. After that, resume all normal activity. With the radio frequency, 0 downtime. As a matter of fact, a lot of women feel wonderful the day of the treatment, and they want to go home and have intimacy because there's been a increase in blood flow to the area and a little bit of a swelling from the treatment itself. And that can add in the sensation. So right away, no downtime, go home and enjoy it. Yeah.
And I'm already at the sign me up. No, I'm kidding. But when you're telling me, especially like I had 3 kids and probably taught aerobics through all 3. And of course, everything known to man in the fitness department. So that tends to also make your bladder just a little weaker. I can't say that I have the problem that some people have when they're jumping or jumping rope, but I still feel like it's on the weaker side. And if something like this could help you, I mean, yes. Amazing. Now, this is probably going to be out of pocket, correct?
Yes. Unfortunately, the insurance companies do not recognize any of these issues as a treatment for an illness, even though urinary incontinence really is, but they view it as quality of life. And for women, that doesn't matter. It's part of my pet peeve. Hopefully the goal is, in my efforts of trying to get these treatments recognized as absolutely necessary and maintenance of our health, they may become mainstream and hopefully get covered and more accessible to everyone, not just people with the money to pay the extra bucks, which is, you know, disappointing. I mean, they're not overwhelmingly expensive, but they are costly because, unfortunately, for the physician to buy these devices, they're outrageously expensive.
Yeah. So when a person decides to go with this type of thing, what is it called? What are we looking for? And expense wise, what is our range?
Okay. Well, of course, it depends on where. I have two offices, one in New Jersey, one in Manhattan on Park Avenue. The one, obviously, New York City, I'm paying that outrageous rent. It's going to be a little bit more expensive, but the range is around no more than $2,500, $3,000 for 3 treatments.
Forget about it. That's that's fine. That's probably not that much.
And you can actually finance it. In most doctors' offices, you can finance it so that it is, you pay per month and no interest. So most physicians have plans for
I
financing.
mean, seriously, to get your relationship on track and to feel the way that you felt before,
Yes.
I think it's totally worth it. It sounds like it's a game changer.
100%.
Yeah. So, and what about women that are having all kinds of other issues like hot flashes and night sweats and belly fat and all the
Mhm.
things? Do you recommend the bioidentical hormone therapy? Tell us about the bioidentical, why it's better than the regular synthetic, and also we'll dive in a little bit after that about how it's less cancer causing.
Absolutely. So bioidentical hormones therapy means identical to what our body makes and plant derived from nature. That's what bioidentical means. And they're delivered and compounded in different ways. The compounding pharmacies in the United States prepare gels, topical gels. They prepare troches, which are little tablets for underneath the tongue, oils that could go in the mouth as well, and also injectables and pellets. All of these methods have different absorption qualities and can be regulated with blood work and tailored to the individual. The pellets is my favorite method, and that's what I use for myself and recommend for my patients, simply because it's a very steady state delivery system. They dissolve gradually over time, in women over 3 to 4 months, and in men over 5 to 6 months. So I will treat the couple. I'm a gynecologist, but if I'm treating my woman and I have her primed, I need to make sure he can keep up, pun totally intended.
I'm glad you said that. You guys hear that out there? Make sure they can keep up with you.
That's right.
So the pellets,
Mhm.
that's interesting that they dissolve, take
Mhm.
longer to dissolve in men than women. What is the reason for that?
We give them a heck of a lot more, and they're
Oh,
larger in size. It's a matter of dosing.
and so why do you think the pellets over the creams and things to put under your tongue?
Because again, it's absorption and steady state.
Okay.
Number one, when it comes to the troches, you have to do it as a patient. You have to take it every day consistently. And some people are non-compliant. Sometimes they forget that they're only human. So there's lack of consistency there. And when you have peaks and troughs of hormones, that's never ideal. If you can keep things more even keeled, you're going to feel more steady state. And when it comes to gels, my heavens, those can vary absorption per humidity in the room. and how much moisture you have on your skin that particular day. So that's where you see even more variability in absorption, is through just topical. The other issue with topical is transference, meaning applying estrogen and progesterone to your arm, or testosterone, and you pick up a grandchild or a baby or a chihuahua. They can, yes, I saw one of my patients yesterday who had been on topical creams, and I said to her, if you have a small dog, have you been careful about holding the dog? She goes, oh my gosh, my dog is having a fake pregnancy, a false pregnancy. And it turned out from her topical hormones on her arm.
Oh
And
my gosh,
yep,
that's wild.
I know. And I've seen another little chihuahua come in with her period. Yeah. So it's very real and very possible. So I do that. These are reasons why I just prefer it to be out of the patient's hands and in directly into their adipose tissue, and it just dissolves over time. I've been doing it for myself for 7 years now, and it makes you feel youthful. It brings you back to feeling youthful.
Oh, right, for sure. And
Yeah.
energy
Yeah.
and also libido.
Yes. Libido, sensation, mental acuity, quality
Mental
of
acuity. Okay.
yes, and quality of sleep.
Oh my gosh, right? The progesterone. Do you give progesterone?
Oral progesterone at bedtime, but even without the oral progesterone, the testosterone alone helps you sleep.
Okay. Yeah.
Yeah.
Oh my
I'm
goodness.
wearing my little aura ring. These are fun if you don't have one. And they measure your sleep at night, and they measure your heart rate, and they tell you the quality of sleep you've gotten. Well, before hormones, I was sleeping 3 hours a night, which is not compatible with my lifestyle.
Not at all. You can't have energy.
Yeah, exactly. So,
So how
getting
do you spell that ring? Or aura?
OURA.
Okay.
Yeah.
I was thinking it would be the other. So I'm glad
Yeah,
you spelled
no.
it. Um, so you like that because it tells you
Your
what you need
quality
to
of
know.
sleep.
Yeah,
Yeah.
sleep is
Yeah.
huge for weight loss. Now, my question
Yes.
too is uh custom
Yes.
tailoring this, one size doesn't fit all. I totally
Absolutely
want to hear
not.
about that because I was going, getting bioidentical hormones,
Mhm.
and they were never checking my levels. And
Oh.
so I was thinking that's not good. So tell us
Mhm.
about why the custom tailoring, and checking
Yes.
your hormone
W-
levels and making
Yes.
sure everything's right is so important.
Yes. They're basically, what we do is we do comprehensive blood work to begin with. We're checking everything, your cholesterol panel, we're checking all of your blood counts, absolutely everything, checking vitamin D levels, vitamin B12 levels, and also your hormones in detail. So thyroid, for example, there's more than just a TSH level. There's T4, free T3, T3 reuptake, and there's also thyroid antibodies, because
Oh, that's the one I didn't
many
get. Yeah, I got all the others.
so many women have something. The measurement on your lab would be a TPO, which is thyroid uh antibodies. Your body, for some reason, in so many women, bites off your own thyroid, and that's called Hashimoto syndrome. And most of the time it doesn't even wreak havoc, it's just something going on behind the scenes. But at other times, no matter what you do in trying to replace your thyroid function, normally the way that the internist would normally would is not adequate in making patients with this condition feel better, because their body is fighting off their active thyroid products. So it's a matter of tweaking, I call it. So once everything is in front of us, then we tweak whatever needs to be fine-tuned to optimize your health. And we will add whatever hormones you're willing to take. We explain the pros and the cons, whether it's thyroid or progesterone, testosterone, and estrogen. Those three, estrogen, progesterone, and testosterone, are the three hormones our ovaries make. And once we go into menopause, they go down to virtually non-detectable in our bloodstream.
What does?
Estrogen,
Oh,
progesterone,
non-detectable.
non-detectable. You
Oh my,
can't
my.
even
We can't have that.
less than 3, less than 5, like not
No,
even
no, not for our
identify.
girls.
No, you cannot have muscle like this if you don't have your hormones in balance. It just doesn't. You can work out till the cows come home and eat just right. Over menopause, it's so tough.
So that makes sense, because a lot of the complaints are then after, the dry vag, not enjoying the
Yes.
sex, the weight gain, the belly fat.
Yes.
Is also, why is my skin all of a sudden
crepey?
Yes. And why I lift and lift and lift, and I'm not getting the leanness and the muscle I had just a year ago or 2 years ago.
That's right. That's it. Losing that testosterone, even if it's a little, our testosterone will wane in our early 40s. So many of the women I hear beginning to lose their libido are in their early 40s. And they're saying, I'm just not interested anymore. I don't care if he touches me, doesn't touch me. I don't even think Brad Pitt's handsome anymore. Like, what? George Clooney isn't doing it for you. So when those things happen, then that you've got to explore everything physiologically going on. And
that makes so much sense.
Mm-hmm.
But then also your partner makes sense too, because if they aren't wanting it and you start really wanting it, then you got to disconnect. So you got to be kind of on that same kind of level, right?
100%. Takes two to tango.
Yes. yes. Oh my goodness. My cheeks are getting hot now.
Then I've done my job.
This is right. So much good information today. What about weight gain? If you give me like pellets and I have testosterone and estrogen in there, and am I going to gain a little weight?
Good question. Weight is relative. And I will tell you that a lot of physicians in this field, what we're doing is getting specialized machines, scales that will measure not only fat, but muscle content. And what you can see when you begin using testosterone is this number on a traditional scale may go up, but your clothes are going to fit better and you're going to look significantly better.
Yeah.
And what we're discovering when we put our patients on these magic scales, that not only are they losing fat, but they've built muscle without even trying. No need to go to the gym. No, it just happens naturally. Gracie agrees. I apologize for her participation.
It's totally fine. I have 2 little fur babies.
But that's the situation, is that we're actually gaining muscle and losing fat. And for anyone interested, 1 pound of muscle weighs 4 times what a pound of fat does. It doesn't make sense.
We look so much better when we're toned than when we're just like, it's all sagging. What do I do? And let me ask you this. Is it too late for us if we are sagging, or when we take this bioidentical hormone cocktail of whatever the mix is, custom tailored to us, is that going to rectify the situation?
It sure does. It
Perfect.
really, really does. And it's just a matter of minimal effort, which will be natural. You're going to have the energy. You're going to have the desire to feel good. You're going to feel sexy. And with that, everything comes together. You have a natural confidence about you when you enter the world. And that's what makes the whole
Yeah,
biggest difference, right?
I think women, if they don't have that going on,
Yes.
they start to lose their feminine power, that
Yes.
they feel less like confident
Mm-hmm.
and invisible, like they're not being seen or heard anymore. Like they
Yes.
lost their femininity, is what it feels like. And I don't
Mm-hmm.
know if anybody out there can relate to what we're talking about today. Nobody hardly talks about this in
Yes.
length like we are. And I think it's such an important topic for all of us. You know, if we're suffering from any of this, like we don't have to suffer. Like that's your mission, right?
That's right. That's right. I've been on
You
my
don't have to just lay
soapbox.
there and wish it was over.
Oh gosh, right? Like this, I was like, at the beginning, I was like, oh my
Yeah.
gosh. It's a good thing it's dark because if the lights were on, he'd see my face. It's just a shame. No one should feel that way. And that was the point. I found out
Yeah.
that these lasers existed. I was blessed to have uh had a med spa already. I was already in that realm of dealing because I stopped doing obstetrics to raise my kids. So stopped doing obstetrics. I was just focusing on GYN. The income had dropped. So I started doing the med spa, Botox fillers, the hair reduction. And I understood lasers. And when the company came to the United States with a laser for the vagina, they sought out gynecologists who might understand lasers, and they found me. I was blessed to have them walk through the door and show me the capability of this technology. And when they told me it could improve vaginal lubrication and help urinary incontinence, I said, wow, you're speaking my language. Let's get this going. So
Perfect.
yeah, so I was in the space and then I had to find out what else was available. And with, needing some women who can use hormones, who want to maintain their optimal health, bioidentical hormones is the way. When it comes to sensation and not using hormones, there's platelet rich plasma, the O shot you may have heard of, and that's miraculous in bringing back natural blood flow and innervation to the genitalia in both men and women. Beautiful. PRP is a part of our own body that helps us heal ourselves. Wonderful ways.
Do you knock us out?
No, never. Um, no, no need to knock you out. Now, I always have Pronox, which is laughing gas. So should someone be particularly anxious, I can give them laughing gas, like
I'm
at the
asking for a
dentist.
friend. No, I'm just kidding.
But for these procedures, 99%, you do not need them. You do not even need it, but I always have it as backup if you desire. I
I
use
already
it
know
for
what all my females' questions will be, so I just ask them because I can just hear them in my head, like the girls
cringing,
that come in
right?
my studio, like, oh, can they knock me out? I don't want to be awake for this, and like the O shot, I'm like, oh no, is that gonna hurt?
Not at all. That one really doesn't. As a matter of fact, you're so numb. And the version for men is the P shot. And for men, their penis goes so numb.
The
There's
big O
all,
shot.
yeah. And they've panicked like 5 hours. They're all calling, are you sure I'm ever going to feel my penis again? I'm like, I promise. I promise.
Oh my gosh. Now you're making me laugh because this is sad, but I was talking about, I'm trying to remember how I brought this up and why. I know it had something to do with a podcast that I had. And I said the big O.
Yes.
didn't know what the big O was. And I was like, we have some work to do. So I'm glad I'm glad we're having this podcast today.
Yeah.
Because the other thing is I remember my gynecologist saying, she was there because she doesn't want women to be like, when they go to their doctors, I'm not enjoying sex. And they're just like, well, just, fake it till you make it. And not worried about the fact that the women aren't enjoying sex anymore. And I think like this is like a miracle cure, in a way.
Yes.
And also let's go into the detail of the studies. Do you have any studies? Because I know I've heard some of them where they compare the HRT and the cancer causing versus the bioidentical.
Yeah. So basically, synthetic hormone therapy, meaning anything that you unfortunately that you get from a pharmaceutical industry, it can't be called a drug unless it's not bioidentical. So if it's bioidentical, it's not a drug. Therefore, the pharmaceutical industry makes no profit. Okay. So
follow the money trail.
That's right. So if something is made by the pharmaceutical industry, it's synthetic. Anything synthetic is not going to be perceived as natural in our body. And if it's not perceived as natural, our body will react differently to it. So there was a huge study that concluded in 2002 prematurely. They stopped the trial. It was called the Women's Health Initiative, which explored the use of synthetic hormones given orally that showed that it increased our risk of breast cancer. That was a horrible day for women because women had been using hormone therapy in order to get through the difficulties of menopause and just enough to take the edge off, because the synthetic hormones are not made to make us feel youthful. They're made to make us tolerate the symptoms of
like
menopause.
the Band-Aid that most
That's
I call it sick
right.
care.
Yes.
They place a Band-Aid instead of getting to the root cause of whatever
Correct.
the problem is.
Right. Whereas bioidentical hormone therapy is to bring you back to a youthful state. What were the hormone levels that were natural at the time when we felt primed, when we felt our best? And those levels is what the bioidentical hormone therapy. But when you have those hormone levels, they are natural, not viewed as foreign in our body, and have not been seen to increase the risk of cancer, breast cancer, or any other cancer. And when given through the skin, it also eliminates the dangers of cardiovascular disease, blood clotting, heart attack, stroke. And let me point this out to all Americans that heart disease is the #1 killer of women today, 3 times more than all cumulative cancers. None of us want cancer. That really gives us the heebie-jeebies. Yeah. But mind you, it's heart disease killing us 3 times more than all cancers put together. So let's keep that in mind when we try to treat our conditions. And our hormone therapy is going to maintain our cardiovascular system. It improves our lipid profile, meaning it gives us better cholesterol and improves the good cholesterol over the bad cholesterol. You're increasing muscle tone, which gives you the ability to burn fat at rest. You know that being a wonderful athlete, you want to build muscle so that when you are resting, you're still burning calories. And without muscle tone, you can't do that.
Right. And it's so important. Yeah. The muscle, as you start to age, to maintain that, to nurture that, to lift. do a little less cardio and a little more
Right.
weight training and more walking and the bioidentical hormones. And I love what we've been talking about with helping yourself out in all areas and
Yes.
energy, right? Because lack of sleep just makes you depleted. And I'm telling you, I
Yes.
can see it, my heart just for women of this age, or I say of this condition, is you see them suffering because it's like somebody took the pilot light out, you know, they're not having energy, they're tired, which also makes them not want sex probably.
Yep.
It's like, feels like one more job to get done. And I think if we can reverse that for everybody out there, it's definitely serving the female population of a certain age.
Amen. Yes, indeed.
So what is your like story, and how did you get into this, and why is it your mission?
Well, I just way back doing my traditional OBGYN, I wasn't home for my kids. I was truly an absentee mom. I was trying to do it all, but I didn't think I was doing it very well. And my eldest was 10. She's now 30 and getting married in Columbus, Ohio, by the way.
Oh my
And
gosh.
yeah, and so she's a pediatric intensive care physician in
Amazing.
Columbus. Yes. So at 10 though, this sharp little cookie said to me, "Mommy, if you are not in the audience," she was having a piano recital, "if you are not there, I'm not getting on that stage." And it was a Friday. Her recital was at 5, and I knew this. And I had a woman in labor. She was 8 centimeters. So any woman who's gone through childbirth, you know, we're really close to delivery. And I took out my superwoman cape and I said, "I'm going to do it. I'm going to deliver this baby. I'm going to get to the recital and I'm going to be there and I'm going to get it all done." I was 5 minutes late. I run in the back and she's not on stage. And I said, I found her and I said, how was your piano? She goes, "Mom, you weren't here. I didn't get up there."
Oh,
Yeah.
that just killed.
Could you imagine? And I
Yeah,
was
she
like,
felt like terrible.
terrible. And I said, I chose my patient over my own child. These are sacrifices I've chosen to make, not that they've chosen to make. It's going to affect them in the long run. I need to make a decision. So I stopped obstetrics, focused on GYN, opened the med spa, in walked the representative, and I was opened to this whole field of what was originally discussed as cosmetic gynecology, which really gave it a bad rap or
Yeah,
negative connotation because
correct.
I mean, cosmetic gynecology makes it sound like it's about what things look like and has nothing to do with what it looks like. It's all about function, absolute function. Sometimes there are some surgical procedures involved where women have perhaps labia minora, the little lips that are very, very large. These women are having difficulty in bathing suits, in clothing. Literally, we're not talking about minor tweaks there. We're talking about major changes where their anatomy is hanging out of their clothing and embarrassing and mortifying. A recent case I did was on a young 23-year-old who is a dancer. It's her job to be in a little leotard, and her labia were protruding over 4 inches from between her legs, and not compatible with her function. So she was willing to go through. It's not an easy procedure to endure, and I only do it in those extreme cases. But it's not about what it looked like. It was about her functioning in her
Right.
everyday career.
She's like, "Oh my gosh, what do I do?"
Yes.
My costume doesn't have any room for this.
Seriously, yes. So that's, those are situations that people have a complete misunderstanding. And when we're dealing with obviously vaginal dryness, that has nothing to do with what it looks like. It's about being able to tolerate and enjoy intimacy. Our men, they go out and get Viagra. They come back, they're like granite. You're like, where are you going with that? It's hard. It's a little scary. So
Oh my gosh, right? I mean,
yeah.
seriously, I know I trained somebody that must have taken the little blue pill. And I was like embarrassed. I mean, the guys at the gym were walking by going, then I was just like looking up and everywhere, but I was just like, oh my gosh, does he not realize like this is
What's
happening,
happening?
right? The whole hour.
Heavens to Betsy. I would have said, I think we need to reschedule.
I was like,
I
okay.
think you need some other kind of aerobic exercise right now.
But I mean, for real, right? Kind of crazy. So like with the cosmetic,
Hmm.
so do you still have the spa along with everything else?
Yes. Yes, I do.
Amazing. So you do
Yeah.
all these services for women.
Yes.
And let's talk about Botox for a second then.
Sure.
I think that in some ways, cosmetic surgery has been poo-pooed upon, or
Yes.
people getting Botox. I don't know if you all have watched Christmas with the Cranks with Tim Allen and Jamie Lee Curtis, where he's eating cereal and he's like, and it's like, it's not like that, but I just want you to tell people a little bit about Botox and make it a little bit less of this thing where people don't realize that it can make them feel and look young and it's not going to hurt them and it's not a
Right.
big deal.
No. So Botox is a muscle relaxant. That's what it is. And when done correctly, it doesn't have to make you look like you have a deer in the headlights. You don't have to be like frozen anywhere. You can still raise your eyebrows. You can't frown. See, I'm trying to frown. And I do use Botox on my forehead. That's the main location where it's FDA approved for use. And it just helps to soften the signs of aging. And when used correctly, it can just soften the lines and minimize wrinkles and fine lines around the eyes and in the forehead area. Basically, anything else where we use fillers are different. Fillers are sugar products mostly, and they're made of high hyaluronic acid, and different companies make them thicker or thinner depending on how they add components to make them cross-link or more complex. And then they are injected into areas to try to build structure, because as we age, we hang from the side down. You move a little bit down here when you
Where
pull up.
people get jowls.
Right. So by putting filler in this area, it's lifting it up, pulling it back non-surgically. So you don't necessarily, if maintained minimally, you don't want to be
Yeah,
overfilled.
because it stretches the skin out if you use too much.
And it looks kind of funny.
It looks bad, puffy.
Yeah. So when you're overfilled, it can be overdone. It should be done in moderation. And if done, once a year, twice a year max, over the years, maintaining the structure in the face, you may not need a facelift as you age. And an ounce of prevention, pound of cure. So what's happened over time is where plastic surgeons were very hard bent against any of these non-invasive, so to speak, procedures versus a face. Oh, I could do it with the knife. I do a facelift. They're good. facelifts always look like a facelift. You can tell for the most part when someone's had a facelift. The skin is pulled too tight. You know, they have this kind of a look. It's very shiny. The skin's over taut. And that's again when it's been overdone. I think even plastic surgeons have improved in this vein as well. But they have realized people don't want to go through that. People don't want surgery. And if you can avoid it, then they had to delve into the world of fillers and Botox as well. So that's why. And most people that you know are doing it and you just don't know it. Most people are, you
I
know.
think people get scared and they're like, oh, what will people think of me? They're going to think I'm vain. And
Right,
what will my
right.
husband say? He's not going to understand, and all of these things. But I think, like you said, if people realized how many women out there are actually
Yes,
doing it, people you would
yes,
never even dream of.
correct.
And like they've made it very safe, I think.
Mm-hmm.
Like, uh,
Of course.
you may hear of cases once in a while, it's not good. But if you're
Right.
looking into it, doing your homework, doing your research, making sure you're going with a great doctor and a good
That's right.
product, it's far and few between. And it can go a long way to making you feel vibrant, young, healthy, alive, and looking good. So you
Mm-hmm.
don't feel like you look like you're sagging everywhere. What about the neck? What do you do for that?
Mm-hmm. Neck is a very tough area to treat. One of my favorite treatments is radio frequency of the neck. There are several devices out there now. They don't have to be invasive. There are some invasive radio frequency devices, but they're non-invasive radio frequency devices. I use something called Accent by Alma, and it just tightens up the skin by heating the tissue.
Mhm.
Takes around 8 minutes.
Yep.
The other is filler in the jaw area, because
Mhm.
if I pull here, you see my neck moving. So
Yes.
when I put a little filler back here, it actually treats my neck. And that's important. A little off-label treatment with Botox can also be used. That is a little trick that we pick up from
I heard
abroad.
that. What does that mean
Yeah.
exactly?
Nefertiti, the Nefertiti Lift is a procedure where you can literally put Botox in along the jaw here and in the band. See this band? I should Botox that. And what that would do is relax that and stop it from pulling down and smooth out the neck.
Yeah,
The
because
other,
I notice I hate to use news anchors as
yes,
they look young here, but then you see their neck. And so
yeah, yeah, that's it. That's
they're doing something because
yes, yes, yes. The neck is a tough area to treat. So Botox is one treatment, radio frequency, there's sound wave procedures. Those are kind of painful. The there's also what else can we use there? Oh, some women have a fatty neck, and men as well. You can use products called Kybella, which is an injectable that dissolves the fat and can tighten the skin. Cool Sculpting is also a device that has FDA approval for reduction of submental or under the chin fat plus skin tightening in that area. So
and I think a lot of people are for the most part like the idea of non-invasive,
mm-hmm,
something that can be non-invasive but correct whatever it is they're
yes,
noticing. Like maybe they have a mole up here and now it's
mm-hmm.
here, or whatever what I'm
Yes,
saying.
yes.
It's like they know their face is changing, and I think people know they're not going to look like they're 20, but they
Oh,
still, like my mom said, I said something to her one time, about when I get older, I'll just eat what I want because the fat will keep me looking young. And
this is
she
true.
was like, oh, honey, No, you won't. She said, no matter what your age, you always care about the way that you look and the way that you feel. It doesn't
Yes.
matter. Like, she's now 83. She still dresses like she stepped off a bandbox. Like, she's just so like
Wonderful.
petite and cute, and she hangs out with her ladies and she wants to look good, and she's letting me know, no, sweetheart, that's never gonna happen.
That's right. That's right. It's just going to cost more to look the way you want.
She's just saying you're gonna always care.
Of
Yeah.
course. Of
So,
course.
oh
And we
my goodness.
should.
And if you don't, then that's probably why you need the hormones.
That's right.
Oh, this is so fun today. I've really enjoyed this so much. And I hope everybody listening is getting the scoop, because you would pay big bucks to get the scoop we're giving you today. Just going to a doctor, you're going to only get 10 minutes of their time.
That's
And
right.
we so appreciate you giving us so much time to
Thank you.
learn about these things that women are afraid to ask about, but they want to know. And I just think being educated goes a long way to helping you as we start to lose the things that we've always taken for granted.
Thank you so much. I do want to offer everybody my free book. I wrote a little book. It's only about 100 pages. It was in Amazon, Science and Math Quick Reads, because it's only about an hour to read the book cover to cover. It's called at the website, www.ultimateintimacy.net. You can download it for free, and it gives you a little synopsis of everything we've touched upon today.
Perfect. And where can everybody reach you on social media? And also, if they want to come and get any of this done at your place?
Oh, thank you for asking. Instagram is simple, Dr. Carolyn DeLucia. And my website is www.drcarolyndelucia.com. That's it. And if you go on there, you could book an appointment right online. We can do a phone consultation, however you'd like to connect.
That's so great. And I just want to just tell you, you're adorable. I can't believe you're 59. You guys should see her. You look hot and sexy and
Thank
vibrant, and all the things that we all want to keep going, no matter what age we are. What is one thing you can leave with the audience today, like a quote or a tip, something? Just, it can be funny or serious.
All I would say is be yourself, be proud to be you, and be empowered, and do whatever it takes to be the best person you can be. And a little bit of kindness these days goes so far. That's it.
Perfect. Thank you so much. I just want to
Thank
acknowledge you just for being such an expert in your field,
Thank
and
you.
for having, like, basically kind of, you're a little bit of a pioneer,
Yeah.
trying out things and finding out how they work, and caring enough to bring this to all women everywhere. So thank you so much.
Thank you.
And thanks everybody for listening to this episode of the Sisterhood of Sweat. Bye, everybody.
Bye.